This is NBC-6 South Florida Today.
Well, following a mastectomy, more and more breast cancer survivors are choosing to have reconstructive surgery using their own skin as opposed to implants. It's a procedure being perfected by the folks at Cleveland Clinic right here in Weston. Joining me now is plastic surgeon Dr. Martin Newman. Welcome.
Thank you.
And it's amazing, I guess, the advances that you all have made for women who've got to go through a total mastectomy or even a partial. It's unbelievable.
Actually, that's correct. Over the last 20 years or so, we've made several advances in the science of breast reconstruction. And today we have what we think is the latest advance. We not only are able to reconstruct the breast with a woman's own tissue, but to do so with the assistance of certain technology, lasers, for example.
Now, I know that you all are working on a whole new thing, and I think you borrowed some of it from your cardiology department. Explain that to me, because it's exciting.
The ability to image small vessels has undergone technical advancements over the years. Our cardiac surgeons, Dr. Boyd and Dr. Dullum, have utilized this technology to visualize cardiac bypasses. It's laser assisted, it's imaging, and it's done intraoperatively. And it has shown great promise. And we borrowed this technology from our cardiac colleagues, and we applied it to our microvascular surgery, our DIEP flap as it's called. And it has again shown great promise, giving us the ability to visualize small microscopic vessels, magnified significantly, giving us the confidence to proceed in harvesting tissue from the body in one area and replacing it to another part of the body.
I guess the other side of that would be that you could use implants or use your own tissue. How do you know as a patient which one is going to be best for you, and does everybody have the option to go one way or the other?
That's a very good question. Faced with the loss of breast tissue, a woman can either do nothing, she can either reconstruct her breast with an implant, or she can use her own tissue. Each of these options have benefits, risks, alternatives, and potential drawbacks. Some women are more candidates for implant reconstruction, depending upon the look that they want, depending upon their comorbid conditions, whether they have diabetes or they're obese or they're smokers. And some women are more candidates for autologous or reconstruction using their own tissue.
Okay. Now, in addition to doing reconstructive surgery for cancer patients, you do all kinds of plastic surgery at your practice.
That's correct. The Department of Plastic and Reconstructive Surgery at the Cleveland Clinic, we do a significant amount of cosmetic surgery. My partner, Dr. Sampson, and I are well versed in cosmetic, invasive and non-invasive procedures, as well as reconstruction.
Now, what's, I guess, the #1 thing people come to the clinic for? I mean, I know at one point it was nose jobs, and then at one point it was breast implants. What's, I guess, what people are getting most now in plastic surgery?
Well, as you know, there's been a tremendous increase in the amount of bariatric surgery being performed. My colleagues, Dr. Rosenthal and Dr. Shamstein, are bariatric surgeons at our Center of Excellence at the Cleveland Clinic. As such, people have massive weight loss, and they like body contouring. And we've been seeing a significant amount of these people come into our practice.
Fascinating stuff, and thank you so much. Some important advances you all are making.
Thank you.
Well, again, Dr. Newman is at the Cleveland Clinic, Florida, right here in Weston, and we thank him so much for being here today. You can call the clinic if you need any advice on plastic surgery or reconstructive surgery. Now, Bob, over to you.